Assalamu alaikum, Dr. Azka. How are you doing?
Assalamu alaikum, Kiran. Alhamdulillah, I'm good. How are you doing?
Alhamdulillah, I'm doing well. So first of all, Azka, I would want you to just, give yourself a short introduction with my viewers. So that would be great. So then we shall begin with the discussion.
Thank you so much, Kiran. First of all, thank you so much for inviting me on your channel, and it's an honor. I've looked at your channel. MashaAllah, you're doing a great work, interviewing such diverse people with on such diverse topics. So I must commend you on that. Um, for my introduction, I'm Dr. Azka Asad. I'm a dermatologist. Currently, I'm working in Lahore with an institution by the name of Cosmetic Institute of Dermatology and Cosmetic Surgery. So we've got 4 branches in Lahore, and we are dermatologists, and also we've got a team of cosmetic surgeons with us as well. I've done my specialization from Pakistan in dermatology, and I've been working as a dermatologist for the last, I would say, 6 years now in this institution. So that was a brief introduction about myself.
Amazing introduction. So let us begin, Dr. Aska. First of all, as you know, we are discussing about skincare, and our beauty. How can we keep our skin, fresh? So in that regard, what do you think that the importance of sunblock, which that some of the people or ladies, they still ignore it. They think, oh, why should we spend money on it? So what would be your thought on using sunblock in today's day and age? So I would like to definitely listen on that.
Kiran, that's a very important question. The thing is that, especially in the era we live in right now, we've got so much pollution all over the world, and especially in Pakistan, it's not only the sunlight, it's the pollution that we, encounter every day in our life. So sunblock is a major thing, that protects us from, first of all kind of harmful light, and also it gives a layer to your skin, so pollutants and everything else that also creates a barrier from all those things. So I encourage my patients, and not even patients, young girls, to start using sunblock from early age. Jinki, the patients who have skin problems like acne, like pigmentation, melasma, it is, 100% essential for them to use sunblock. Without that, it's very difficult to treat these conditions as well. But even if you have a normal skin, and you're not, experiencing any skin conditions, even then, sunblock is a must. Start, encourage your children to start wearing sunblock to school, and that takes you a long way in life. आपकी आगे जाके जिंदगी में that will help you. आपकी skin के अंदर photo aging, ये सारी चीजें, they get delayed. So it's a very good investment in your skin. एक और छोटी सी बात, people tend to not use the sunblock, because some years before, जो sunblock आते थे, they were really thick and oily, so people, they felt uncomfortable wearing the sunblocks. But with advancement and everything, there are a lot of variety in sunblocks. We have gel based, which are just like primers, so आप easily लगा सकते हैं. You don't even know there's something on your face, and you can easily apply makeup on the sunblock. We've got spray-ons now, so it's very easy. Sometimes you have to use 2 to 3 sunblocks to see which sunblock is suiting you. But in the end, again, emphasis, it's a must for a good skin.
All right. Now, when we talk about sunblock, of course, this is must. But if for my viewers, information and guidance, what would you suggest? SPF 30, we always see on the product that this product is SPF 30, this product is SPF 50, and even though I've seen 60 as well. So if you can just elaborate a lot more, and for children, I think which product, if you think so that children, they should also put on sunblock, and if they should, so what sort of product should it be, light or sensitive? Please just elaborate that a little bit.
Care for children, there are a lot of moisturizers now which have sunblock in it. This SPF 30 tak bhi hota hai. That is perfectly fine and safe to use on children as well. Regarding the SPF, whatever SPF, it's safe 30, 40, 50. That's fine. When you go on a higher SPF after certain, it doesn't really make a difference कि वो कितना ज़्यादा SPF है उसके अंदर, ठीक है? So the thing is, if you have a lot of sun exposure and you're always out, if you've got some job like outdoor job, then you can go on a higher SPF. But 30, 40, even 50, that's fine. I'm okay with 30 SPF as well. And the thing, and another important thing is that whatever SPF you're using and whatever sunblock you're using, it only has its effect for 2 hours. So after 2 hours, you have to reapply your sunblock. This is something which people tend to ignore and think कि हमने सुबह बस लगा लिया तो we good till in the evening. That's not true. If you're going to your work in the morning and if you apply your sunblock, it is essential that if you're traveling back and it's still sunny outside, you have to reapply your sunblock. So that is something that you have to keep in mind.
All right. Okay. Now, in regards for, if I just ask you exfoliation, it's a new terminology, it's a buzzword. People now getting to know more about it. And of course, toner, which is another product. People, they use it. And some mask and facials. What would be your thought and doing a sort of exfoliation? And if we should do some sort of exfoliation, what products would you recommend? And in a week, how many days we should use on exfoliation, toners, and some mask and facial? What would be your thought on that?
And it all depends on your skin type and also in which age group you are, right? For a young skin, I recommend that you should be, cleaning your skin with a good soap, a mild soap or a face wash. It should be mild, and moisturize your skin and use the sunblock. So now for a young teenager girl, that's the regime. Unless they're having breakouts and they're suffering through acne or any other issue, then things change. When you go in your 20s and early 30s, obviously the regime changes that, right? Also, it depends on the kind of skin type you have. If you have dry skin, too much exfoliation would in fact harm the skin, right? And in oily skin, it does help. So exfoliation with any good product, we as a dermatologist, we recommend stronger medication. We give some stronger medications which you use once a week for exfoliation, but that kind of products, they should only be used under doctor supervision. So any good, I won't take any brand names, but any good brand, don't use those I'm sorry, I'm using taking those Chinese and Korean unless they are brand names, because they have harmful chemicals in them. So no, bleaching agents, steroids, they can, I've seen girls using those products and ending up with massive amount of acne, hair growth on their face. So use a good product exfoliator. And exfoliation you can do on your weekends, again depending on your skin. If you have an oily skin, you can do it every other day, every third day. If you have dry skin, do it on a weekend just to cleanse your skin and then immediately apply toner, because what exfoliation does is it opens up your pores a bit, it cleanses your pores, so we have to close it down with the toner. So that's the science behind it. But if you have any issues like you have acne, you have eczema on your skin, if you have pigmentation on your skin, then I would strongly recommend that see a doctor and get under the supervision of a doctor for all these procedures, because you might end up making things worse for yourself. Because I've seen patients for acne, they are doing, home remedies, doing home facials, and that tends to increase the acne. So your question was if any recommendation. Again, a good company, a known brand, and see and it should be very mild, so you don't end up having any problems with your skin.
Hmm. Okay. Now another problem, which normally ladies they have it with age, you can say max 30 or 35. They have some marks on their faces, and maybe wrinkles is another issue. So how we can, ladies can get rid of these problems, like in regards to wrinkles and some spottings and some marks.
Yeah, marks, the pigmentation, it's a very common thing, especially in our part of the world, because we've got, a type 4, which is a little bit darker than the Caucasian skin, European skin. So we end up having pigmentation, especially after childbirth as well. So for that, I recommend some lightening agents. Again, depending on how deep and how bad is the pigmentation. And we also recommend some procedures like microdermabrasion. Very light, medicated facials. Which just take care of the superficial layer of the skin to lighten those pigmented marks. There are a lot of medication available for that, and that again should be under doctor supervision, because if you're using high potency medication, people tend to end up burning their skin. You must have heard about the ordinary products. They're very good. If you're out of Pakistan, and I usually recommend my patients who are out of Pakistan, and I can't prescribe them anything from here. So but again, you have to be careful on what combination you're using, how much strength of a retinols. They're very popular these days, but always start off with a very low potency retinol, and not every day use moisturizer, because it dries out your skin. So I've seen a lot of patients start using retinols and then end up burning skin. So I'm not trying to scare, but what I'm trying to emphasize is that you should always be, because a lot of things are available now, but if you don't have the knowledge and to how to use them, you make end up making things worse. Regarding the wrinkles, for wrinkles, um, creams. I know a lot of creams are advertised now for wrinkles. They, you know. Can't really take the wrinkles away. You can slow the progression with retinol serums and retinol creams, but if you have developed wrinkles like on forehead, around your eyes, around your nose, for that, first of all, Botox is a very good treatment option. Nothing to be scared of. It just paralyzes your muscle a little. So, when you're make an expression, the lines we develop on the forehead, they lessen. So we can talk about Botox later on in detail. Also, there are a lot of lasers and procedures which induce collagen production. So when you have collagen production, it helps in getting rid or lessen the wrinkles on your face. Like there's CO2 Fraxel laser, you can have PRP done, you can have radio frequency with microneedling with various kind of serums, mesotherapy. So all these procedures help in making new collagen and giving you a youthful appearance.
Okay, for my viewers, I would just, I think inform that if they have any sort of questions in regarding that, what should we ask from my dermatologist, like, particularly they want to know about something or some procedures they want to go into, but they still, have some sort of, questions, or they're still in confusion. So definitely we would be waiting for your questions. So according to that, I would design my second episode of this particular in regards for skincare session. Uh, Dr. Aska, because today what I was planning that we shouldn't discuss a lot more just in one session, because if you're just gonna go slowly and gradually, so my viewers they would also be able to understand properly. So last question, I think we should just ask now, and then I would just discuss with you for the next session, and definitely we're gonna bring it up because my viewers would be more intriguing, just getting to know more about skincare routine and stuff. So two questions just take from my side for now because I also myself wanted to know a lot more. This is, I think, a broad topic we cannot cover, but still, we're trying our level best at as much as possible. In regards for serums these days, people, ladies, they are just, going crazy to spend a lot more on this, and those sort of serums which are available in the market, they're so expensive. What would be your recommendation if somebody really wanna go for the those sort of serums? Serums, you can say, effectiveness, if you can discuss a little bit about that, and some alternatives also, those ladies who cannot afford those expensive serums. So what they should do, maybe you can say from their kitchen, how any tips, any their tips and tricks they can use. And another question, you just take it, so then you just try to cover both. And beautiful and nice night skincare routine, like, lady, they before going to bed, what should they do, what sort of moisturizer or the way, or a care sort of routine they should just follow before going to bed. So then on both questions, please respond.
Sure, Kiran. Regarding what you were saying, right, before these questions, I agree with you. It tends to get very confusing for the patient if you're discussing too many procedure at one time. But sometimes, when a patient comes in, he or she doesn't have just one problem. So there are different things going on the face, and we need different procedures for that. So what I always do is I discuss the procedures one by one with the patient briefly, and I write down all the name of the procedures which I've discussed with the patient, so just they can go back home, read about it. Everything is available on Google these days, and so they should know that what they're getting into and what the procedure I'm talking about looks like, and what they can expect after the procedure. And obviously we don't do multiple procedures at one time. We always make a plan for a patient, that this is the most important thing. That can be my recommendation, or the patient can tell me, this is my main concern, I want to get rid of this thing first, and then we'll go to the other problems. So we design the treatment according to that. Okay, so your question was about the serums. Yes, a lot of serums are available with different companies, different strengths, and they are good serums. Always use available over the counters low strength serums. Dermatologists have, we always have higher strength, so we know when to prescribe and how to do that. So about serums, the most common ones are vitamin C serum,
Yeah.
retinol serums, nicotinamide creams and serums are very popular these days, alpha arbutin, these kind of serums. So vitamin C is good, and it gives your skin a youthful appearance. It lightens down the pigmentation, um, but again, it dries out the skin. So when you're using a vitamin C serum, you could use it in the afternoon, in the morning, anytime you want, but always apply a moisturizer on it so your skin doesn't get dry. Retinol serum, it's good for anti-aging. When you're in your 30s, you can start using it. For girls who are in their 30s, I would recommend not using it every day, every other day, or maybe even less than that. And another recommendation that I would make is, whenever you start using any serum, start off with less time. Start with 2 hours application in the afternoon or at the night. If your skin is okay with it, you can increase the time in the next week. And if you're still okay with it, if, for example, retinol serums, if, in 2 weeks, you can apply for 4 hours. And in the third week, if your skin is tolerating it, you can go for overnight. So always make your skin comfortable with the product. So over-the-counter serums which can be safely used are, in my opinion, vitamin C serum and retinol serums. Nicotinamide, it also helps with the acne and also your pigmentation. And the rest of the things, again, consult your doctor first. Um, there are a lot of companies, which have these serums. You can always go for a higher priced one. That is okay. That's your choice. I don't know about, over there, but in Pakistan, we have got, multiple companies, and every company has a good product. So I have options of vitamin C with, a reasonable price. I've got higher prices as well. So it all depends on what your pocket allows you. And regarding the night care, again, as I've been emphasizing from the start, that it all depends. If someone has a particular question about their skin type or their age, then I can give a exact answer. But for a good skin, for the most important thing, which we all tend to forget, is wash our face at night before going to sleep. That is something that most of us tend to ignore. We're too tired, or we're like so tired from the day that we say, we're okay, our face is clean. So wash your face thoroughly, and if you can just like slightly exfoliate it, that is even fine. But if you don't have time for that, wash your face, apply any serum that you want. If you're applying a retinol serum, if you're applying a vitamin C, and apply one serum at one time. So don't do a mixture of serums. You can't apply vitamin C, retinol, and everything at one time. That will just burn off your skin. So any serum, and then thoroughly moisturize your skin. Dry skin always tend to age quickly. And wrinkles, they appear on your skin. And another recommendation that I do recommend, if you have time, is when you're applying the serum, then you apply the moisturizer. Do a little yoga on your face. Do these upward movements for some 1 to 2 minutes on your neck, like this, around your eyes, like this. This promotes blood circulation in your face, and it will reduce the puffiness of your face. So try to do it once before you go to sleep, and once you wake up in the morning, when you wash your face, when you're applying your morning serum and morning moisturizer before your makeup, do this exercise again, and you'll start noticing a difference in your face. You'll in a few days. So that's a small tip that I would advise. Okay, so if you were asking, there was another question that if you can't afford the serums, or अगर घर में कोई टोटके कर ले, इस तरह की चीजें. Okay, so the most common thing people ask me about is besan, aloe vera. If we can apply lemon on our face, milk on our face, honey, इस तरह की चीजें. Lemon is very strong. It is an acidic medium. It doesn't suit everyone. So you have to be careful with it. Milk, honey, that if it suits you, what it does is just give you a little moisturization. So I would advise, instead of wasting milk and honey, you can always apply a good moisturizer. There are a lot of good moisturizers. If we talk of internationally, there's CeraVe, there's Physiogel, there's Cetaphil. These are good. They have got oil-free products. They've got oily. So depending on what your skin is. Aloe vera doesn't suit everybody. Aloe vera se bhi I've seen allergic reactions develop. Same is with base है. So if you really want to use it, आप अपनी skin के ऊपर थोड़ा सा test spot कर लें और देखें if it suits you, वो आपको redness तो नहीं कर रहा, वो आपको itching तो नहीं कर रहा, और अगर आपको ऐसी कोई चीजें कर रहे हैं तो please avoid it. मैं लोगों को बहुत ज्यादा home remedies इसलिए नहीं रोकती क्योंकि you know वो एक होती है, they have their belief on it. But if you're coming to me and I've given you a proper prescription, then yes, I would tell you कि avoid it, क्योंकि फिर मुझे पता नहीं चलेगा कि आपको मेरी मेडिसिन से कोई प्रॉब्लम हो रहा है या अब आपकी होम रेमेडीज आपको तंग कर रही है.
Yeah, Dr. Azka, like, for skin test, normally would have heard that if you just wanna do the skin test, some particular areas of your body, you just have to do the skin test. Whether I think the wrist side and the elbow side, yeah, arm side, and then behind the ear, is it okay behind the ear? Okay, yeah, this I wanted to confirm because people they would be confused.
Best place is upper arm. So
All
एक तो ये नजर भी होता, this is just mark the area, and this is the best place to test any product that you want to use. Even for hair dyes, some people have hair dye allergies. So for them, I always, if you're using a new hair dye, just do a test spot over here, and then you can see कि अगर वहाँ पे कोई problem है, if there's any redness, there's any itching, any small pustules develop over there. So you'll know you're allergic to the actual product.
All right. For my viewers, I just have to tell them that we would be discussing in the next episode some procedures, and especially the procedures what you are doing in your clinic. We're going to discuss. I will just ask you in the next episode some other products as well, and then some products which we always think like these should be like go-to products, which I would also discuss with you, that we're going to discuss and bring up about these things. And I think for now, and yeah, I would be waiting for my viewers questions as well, so then we would definitely gonna bring them up in our session. So for now, I think I'm going to close the session. Thank you so much, Dr. Azka, for taking out some time, and soon gonna see you inshallah in next episode. Until, take good care of yourself.
You too, take care. Thank you, Kiran. Allah Hafiz.